Looking at the field from a global perspective, are there certain regions that tend to be more receptive to vaccines and immunizations, or others that tend to be maybe a bit more resistant?
Yeah, that's a good question. I think, and in terms of geography, you mean the regions, like the WHO regions, right? So I think each of these regions, they are really, really different, like in terms of how mature the immunization programs are. But it's not just the regions, right? Even within the regions, different countries are really different in terms of um, how mature the immunization programs are, or in terms of what's the milestones with the implementation of the strategies and the different set of challenges they approach. And this trickles down even from a country to a subnational level in a rural setting versus a urban setting. So I think at the global level, the first point I'd like to say is that we really need to look from a holistic lens, but also make sure that it can be tweaked and adapted to the regional and the country context. That's one thing I want to say. And the second thing, I think this working with immunization and seeing this really building block of this unique collaborations and work team effort is really, really unique. And mm, so this is there is really good harmonization of work coming from the region, from the countries to the regions, and regions to the headquarters. And at the headquarters level, we kind of pretty much try to be respectful to the regions and not work directly with the regions, but we try to work with the regions if you want to support the countries. So we don't try to work directly with the countries, and all of this kind of fits into so in this way, this understanding of different strategies of where regions are and what are the challenges, it does come along with the programs, and really the support that goes out to different regions is it's different based on the demands that's coming from the region, but it's also very challenge specific that's coming out of the regions, right? So I think it's really about having a good working relationship. I feel with the regions is important, and that really, so far I've seen that the regions are very receptive to the specific immunization challenges that's coming from the countries, and they're really, in general, I feel they're very, very receptive and supportive, and they really would like to work towards the betterment of the EPI program. So yeah.
When you've been working with those regional offices or the regional governments, have there been any particular techniques or any tools that you found were particularly helpful that maybe other campaigns could use as well?
Yes, in terms of yeah, I think I've been working a lot with the polio campaigns and with measles campaigns. So I just there is I think the polio program is a very, very mature program, and the even the strategies, the delivery strategies of house to house is very, very, I think it's very effective in reaching door to door to kind of uh, get the coverage up. But that's in terms of strategy. But in terms of tools, I think one of the things that the campaigns has picked up is also about the 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 rapid convenient monitoring system of kind of doing this survey immediately after the campaign to kind of make sure that there is a corrective action taken immediately after the campaign, and that all of the missed children are kind of vaccinated, and a mop-up strategy, which is to vaccinate all the missed children, is an effective tool to kind of get an understanding about getting your coverage high. That's one thing, which is the objective, but also making sure that the corrective actions are taking place immediately after the implementation of the campaigns. Yeah, I feel this is a effective one, right?